for spotlighting MEVI and also for turning the Institute into a formidable force that the administration, Congress, and the media pay attention to. And I also want to thank our partners, CHD, MAHA Action, Highwire, the Vaccine Safety Research Foundation, the McCullough Foundation, for streaming this event today, because what they have done is really taken this discussion in this room and made it into a national forum. What we have heard over the course of today is really we've followed the MEVI story from three different angles. We have looked at the massive scale and scope of the vaccine injury epidemic. We have looked at it from the COVID angle and seen some of the same patterns being underscored. And we've also heard from our clinicians who are really embarking on a new model of care with informed consent. But we are also reminded that for every statistic that we have seen today represents a child whose life took a wrong turn after a routine appointment. And we're also reminded that if our government can move as expeditiously as it did during COVID to authorize, then it can move just as fast to compensate and course correct. And we are also reminded that just because something is deemed safe and effective, it's not a magic incantation to dismiss what's being observed and our conscience. So what can we do today after what we've heard? Well, there are three things. Number one is we commit to the truth of the massive epidemic of vaccine injury. We have a Secretary of Health who has really put the childhood chronic disease crisis on the federal agenda, and he's directed HHS to really investigate what has been ignored. Second, we commit to informed consent as a non-negotiable bedrock of American medicine. We've seen today the massive scale and scope of vaccine injury, and that's why we need to get behind legislative actions in our respective states that can codify informed consent and that can ban these vaccine mandates so that we can guarantee that no child is excluded from school because of an informed consent vaccine decision that was made. And third, we commit to action, disciplined, strategic action. The MAHA Institute was created to institutionalize the health freedom movement, to create powerful policy, to influence our federal agencies. But our action also matters. Because years from now, people won't remember every chart or every citation mentioned today. What they will remember was that in early 2026 in a gilded room at the Willard, a line was drawn that parents and practitioners came together and chose not to discount this vaccine injury and the massive scale of it as mere anecdote. But this is real. And therefore, as we walk out of this room, I'd encourage all of you to think about these three actions. Number one, vocalize MEVI. Bring that into your conversation. Number two, demand informed consent without exception. And number three, stand with our HHS leaders and Congress who are really putting the health of our children above the health and the comfort of the institutions. And if we can do that, bill by bill, state by state, family by family, child by child, then today wouldn't have been just an event, but today would have been an inflection point that accelerates us to our goal of making America healthy again. Thank you very much.